My topic is on the phase contrast microscope used in dentistry. I'm a dental hygienist and I was able to use the microscope in 20 years of clinical practice. So this is what my experience was using the microscope. It was first built, the phase contrast microscope was built in 1938, and the reason was that so that we were able to see the viewing of live microorganisms in their natural state. Everybody's dentist, everybody's dental orientated here, right? So I don't need to go through the basics of periodontitis. What we're going to be actually looking for is different species of organisms that create periodontitis. So research shows us that periodontal disease is related to different types of disease-related bacteria that's able to survive in the oral cavity. This bacteria creates infection of the gums, and infected gums create inflammation. Research is now showing us that most illnesses start in our body with inflammation from one source or another. This makes gum disease, periodontal disease, bidirectional. This is a study came from the American Journal of Dentistry in October of 2013, and it highlights that oral biofilms harbor several types of species of bacteria as well as spirochetes, protozoas, fungi, and viruses. And this is what we're able to see with the phase contrast microscope. Time magazine is very popular in the States and in Canada, and this was from 2004, stating that inflammation is the biggest reaction to heart attacks, cancer, and Alzheimer's disease, and what can we do to fight it. So there's 3 different ways to determine which types of bacteria are present. We've got, you can culture your bacteria, you can use the gram-negative staining, or you can use the phase contrast microscope. To culture the bacteria, you can determine what types are present, and it also will provide a list of the sensitivities for you. The disadvantages are that for me in Canada, we had to ship it to the States. It took up to 2 weeks to get the report, and it's expensive. Gram-negative stainings, you can see what type of bacteria is present. You also have to send that to a laboratory for analysis. It takes about 1 week, and cheaper than having a culture done. The benefit of the phase contrast microscope is you can see it right in the clinical office with the client in the chair. It's cost effective. It's the cost of your microscope in your slides. You can take it within a few minutes. The clients can see it right there with you. When they get to see their own bacteria moving around, they have a better understanding of the infection process. Up until now, they just see or they just hear what we tell them what's going on in their mouth. So a slide is taken to help decide which treatment protocol is necessary. You can take a slide before and after treatment to show them the difference. The slide can be taken at each appointment as well. And now the client is connected to the disease process in their mouth. This is what we're going to be looking for when we're looking for the slides. We can determine with the amount of red blood cells and white blood cells there how much inflammation is present. We can see plaque masses, epithelial skin cells, spinning rods, gliding rods, cocci, diplococci, spirochetes, branching filaments, non-branching, bacilli, candidas, actiniomycetes, amoebas, and trichomonads. So your epithelial skin cells are a large irregular shape with a nuclei in the middle. Your red and white blood cells. This is a development of plaque in 24 hours up to 96 hours. And this other one is a plaque on the toothbrush. This is what the plaque looks like with the phase contrast microscope. I just thought that was nice to see it on one bristle. So then what I do with the client is I actually go through a list and tell them what I'm looking for and what level of risk level. So in a low risk level, you have maybe 1 or 2 white blood cells or red blood cells. You have spinning rods, the cocci, the diplococci, and then the gliding rods. Moderate risk levels are spirochetes, actiniomycetes, candida, and the branching and non-branching filaments. Now, when you're looking at the spirochetes, you have different sizes of them, and sometimes they're very small, sometimes they're quite large. They are all different species, but right now we don't identify which species they are. High-risk level bacteria are your amoebas and then your trichomonads. To take a slide, you just take some saliva from under their tongue, and with an explorer, you take some plaque from in between two teeth. You tease it onto the slide and place a cover slip over it, and you have to press down on it to remove the air pockets, and then you look at it with the microscope. So once the client gets to see all of this bacteria moving around, they're connected to what's going on in their mouth. Everything changes for the client. They're now asking what they can do to get rid of this infection. So we know that periodontal disease is episodic. We also know that it is multifactorial. In the office that I worked at, we used the acronym Honest Age. I would go through a list with the client and discuss what their regular home care is like, their hygiene. We'd look at the occlusion, how their teeth fit together, whether they're grinders. Nutrition, how they felt on a nutrition level, how healthy they were eating. Exercise, if they would work out or if that's not something that they wouldn't do, how healthy they were. Stress levels, well, I would ask them to place themselves on a criteria of 1 to 10, 10 being highly stressed, 1 being very low, and whether they smoke or not, how long they smoked, are they planning on giving it up. Age is how old they are. Genetics, what other things that we're looking at, and exercise experience, and exercise was supposed to be environment. On the other PowerPoint, it did get changed. So these are all the things that we look at and taking into account the multifactorial part of gum disease. We know that the bacteria causes the inflammation, and inflammation creates infection. The inflammation and infection creates disease. This basically is just saying how the medical and the dental communities should really be working together to be looking at periodontal disease and overall health. Inflammation is now linked to many different diseases of the body, and we now have oral systemic illnesses. There's hundreds of research articles on the internet with the systemic connection, and these are the pages that I found beneficial for this presentation. This is a slide or a short video. I'm not sure how to play this. I'm just going to speed this up.
Okay, so we're
film
taking
this for 10 minutes.
some of the bacteria that live under the gum line and putting it on a slide that has distilled water on it.
Oh.
Instead, placing a cover slip over it. And then turning it over to remove as much of the air pockets that we can. Okay, Mike, so what I'm going to be taking a look at is there's different types of disease-related bacteria that are able to survive in your mouth. So this is a chart that will show you some of the things that we can look at with the microscope. So this is what the disease-related bacteria looks like. There's spinning rods, there's gliding rods, there's spirochetes, there's amoebas, and there's trichomonads. There's other skin cells that you might be taking a look at as we look at the microscope. So this is what the plaque mass looks like. Sometimes there's some red blood cells, there's white blood cells. This is what healthy bacteria looks like, and then we can look at some skin cells as well. So now what we're going to be able to do is look at it and decide at a risk level. When you have the spinning rods and the gliding rods, that is an early risk level of gum disease. When you have the first three, the spirochetes, the guiding rod, and the spirochetes, that's a medium risk level. And when you have the amoebas and the trichomonads, that's a high risk level. So then we're just going to go to the microscope now and take a look. Do you have any questions?
No, that was great, thanks.
So here what you have a look at is you can be able to see the spirochetes, the long corkscrew-like shaped ones. There's different sizes through there. There's the spinning rods moving around. And This is an amoeba here moving. Sometimes when you take them and put them on a slide, they do take a while to start moving, but they are this one is quite active as well. Spinning rods, gliding rods. There's a gliding rod coming through there. These are the spinning rods. This is another amoeba over here on the edge here that it's quite dormant sometimes, but you just look to make sure that you get one that's actually moving. Amoebas, this is a skin cell here, large irregular shape with the nuclei in the middle. Actinocynomins and more. Did that stop? Sorry, I paused it somehow. Is it moving? I'm not sure what's happening here.
Okay, Mike, so what I'm going to be taking a look at is there's different types of disease-related bacteria that are able to survive in your mouth. So this is a chart.
Sorry. Just try to speed it up again. Oh, it's not playing. Somehow I backed it up again. Okay. If it'll play there, that'd be great. Well, basically, you've seen all the bacteria. Unfortunately, I didn't have any trichomonads that I could show. But again, this is an amoeba here. This is what the plaque mass looks like. You look for red blood cells and white blood cells. There is a white blood cell there. And I don't know why we don't have this being able to play.
It's because of the problem between the computers, I think.
Yeah.
You have maybe 5 more minutes.
Yeah, that was the end. This it was just going through the bacteria.
Presentation, but in generally some international meetings before the presentations, they declare the presentation technology what we're gonna use, and then generally they don't permit to change the laptops and the systems, because from system to system there are some problems, and if you want to change the laptop or computer or something, please inform the technician friend before, and it is very normal to facing this kind of problems, but I never want to miss those informative pictures.
Well, here it is moving again. We've got, there's some red blood cells over here on the corner. Red blood cell, mostly here. It did have, I'm not sure where we are in this. You can see more of the spirochetes, the gliding rods. I'm not sure if we missed the one. There's a large, massive spirochetes that are all attacking a white blood cell. It's quite interesting when you see it in a big circular pattern, and they're all just attacking it all at the same time. Might be too far along in the presentation. Again, another very active amoeba. Usually when there's amoebas present, they really like a deep, dark, moist area. They don't like, all of this bacteria is anaerobic. So amoebas are a one-cell animal, so that you know that there's a significant amount of infection present when they are able to survive. So then you just decide what treatment protocol you're going to use to get rid of them. Some red blood cells that are dying here. Another very active amoeba with the gliding rods, spinning rods, and spirochetes. We can just let this play out. If anybody has any questions, that's the end.
Topic level, and you see the bacteria and all the rest that's happening there, then you don't really appreciate what they're actually doing and why you're cleaning it, why you're doing what you're doing.
That's the value of the
And-
microscope, because as soon as the client is able to see what's going on in their mouth, from a bacteria level. They're shocked that they see something moving around in their mouth. They can't believe that it's in their mouth. They now want to do something differently rather than having somebody just say you need to brush and floss differently or you
Right.
need to brush and floss more. You've got them, you've connected with them so that you're able to move them to a different health level. It's not even about cleaning teeth any longer. It's about health.
People realize what white blood cells do, right? They know red blood cells, they know white blood cells, and we know that white blood cells fight infection. So all of a sudden, when you see in your slide and you're looking under the microscope and there's white blood cells everywhere, we don't even have to look in your mouth to know there's infection or there's inflammation going on in there,
Right.
because your body is telling us there's white blood cells all over here, that there's an infection that it's trying to fight.
Taught in schools, or when you have the new dentists coming up and stuff like that, is there a microscope somewhere where these guys are being said, hey, this is what's going on in your mouth?
Not as far as
Thank you very much.